All right. Hi, everyone. I'm going to give this a few seconds for everyone to start filtering in as I can see everyone coming in now. Great to have you all here with us. And give this a few more seconds and we'll get started. All right. Well, welcome everyone. Thank you so much for joining us this morning or afternoon, depending where you are. I'm really excited to be here today and to have Margo back with us again by popular demand. We had a really wonderful webinar in the past and really looking forward to Margo's expertise and what she'll share with us today. A few logistical items. If you have questions at any point, please feel free to type them in the chat or in the Q&A here, and I'll be monitoring and I can ask questions as we're on the same topic and make sure that Margo can get back to your questions. And we also have contact information for Margo here if you have questions for her after the fact, and we can always share this with you. This webinar will be recorded and we'll be posting it to our website, so you can always refer back to it, share with any friends or family you think might be interested. And if you have questions, Margo and her team are incredible. We have heard only rave reviews about working together with them. So with that, I'd like to introduce Margo Steinlage. With over 15 years of health insurance industry experience, complemented with a law degree, Margo has become a nationally recognized Medicare expert. Margo's team is a trusted resource for thousands of clients, including probably some of you on this call today, and works with wealth managers, advisors, CPAs, and estate planners across the country to integrate Medicare planning into their retirement discussions. Margo's mission is to maximize the Medicare experience and minimize the complexity. So with that, Margo, I would love to turn it over to you.
Muted. Everybody hear me okay? Okay, cool.
Yep.
Thank you, Lauren. I appreciate it. And for those of you who are here and have worked with us in the past, welcome back. My name's Margo Steinlage. Hopefully, my goal today is for you guys to walk away with a much better understanding of Medicare and know kind of the pitfalls to watch out for as you're approaching your 65th birthday. Or perhaps you're already on Medicare, then this is just a good refresher course of reminding you of why you signed up for your product in the first place, and or maybe reminding you that, hey, it's been a few years, it's time to do a review. In Medicare, there's no such thing as a set it and forget it product. We constantly want to review these products. It's a very volatile industry with regards to the plans and pricing. So you never want to set it and forget it. A little bit about myself and our agency. At Steinlage Insurance Agency, we work with a ton of wealth managers across the country to provide this white glove hand-holding service. As you approach your 65th birthday, a decision needs to be made. Do you go on Medicare or do you stay on your group plan? Are you on Obamacare, ACA? You need to do something, and we are here to provide that advice for free. How we work as an agency is a question I get often. Our agency, Steinlage, I go out and get our team appointed with all of the national insurance carriers that play in the Medicare space. Whether it's Medicare supplement products from 20 different plans or carriers, 30 different drug plan carriers, or the Medicare Advantage market, we can sit down and look at all of the plans that are available to you. And whatever plan you decide on, they will pay us a commission, our agency a commission. Where I take great pride is with my team, not only do we train our teammates who you will be working with. If it's not myself, you're working with my right hand. My team has no idea how the commissions work in the background. They are all salaried, so they really can provide this fiduciary-like experience when you approach your Medicare eligibility. You are getting very neutral, plan agnostic advice, whether or not you need to take Medicare or maybe you are in the camp where you can delay Medicare. So we really attack the conversation with neutrality and are here on the front end with the consultation, the enrollment side, and also on the back end. When you do enroll in the specific plan, we're there from a customer support standpoint, which is really nice because a lot of problems can surface after the fact once you're in the Medicare product. Also, we provide IRMA appeals. Many of you will see higher than normal Medicare premiums because you have a higher than average income. Your modified adjusted gross income is above 206,000. Medicare is more costly. We educate in this income space, and also help you appeal your IRMA surcharges if at all applicable. Another little toot of our horn is we are very proactive with all of our current clients. Every August and September, we are sending out emails and surveys to say, hey, John, hey, Betty, Medicare open enrollment is coming up in February or in the fall, in October, November, December. Send us your updated drug list. What changes are happening on your end? We want to know this so we can make recommendations each year so you're never in a stale product or a plan that is drastically changing. Again, lots of volatility in the drug plan market. Enough about how the agency works. We are licensed in all 50 states, so we can follow you or work with your friends or family, regardless of where you reside. But today I want to focus really on three main parts. First, we're going to jump into who is eligible for Medicare. What are the unique rules around turning 65? Do you have to sign up for Medicare, or can you delay Medicare? All right, so we're going to take a very high level view first of who has to move into Medicare. Then we're going to look at what is Medicare. You know, there's Part A, Part B, Plan C. You have Plan D, Medigap, aka Medicare Supplement. How do all of these plans work and jive together? What are the pros and cons to these different pathways in Medicare? All right, we're going to define, and then we're going to take a deeper dive into how those moving parts work. And then lastly, we're going to look at the upcoming regulation that is changing the Medicare Part D drug world this year and next year. And that's called the Inflation Reduction Act. So we're going to take a deeper look at Inflation Reduction Act and also the IRMA appeals process. Again, as Lauren mentioned, feel free to type away, chat any of your questions. If they're not too lengthy, if they are very specific with your situation, let's have a sidebar conversation. Shoot me an email. I'll put my email up here at the end of the presentation. But let's keep things efficient on the actual call, and then I'm happy to hop on a call with you, a scheduled call with you if you have a one-off question. Okay, so high level view first. Who is eligible for Medicare? So the general rule here is that anyone turning 65 needs to sign up for Medicare A and B to avoid lifelong penalties and gaps in your health insurance. So that's the general rule. You need to sign up as you approach 65. You have a 7-month window, 3 months before your birth month and 3 months after your birth month to sign up for Medicare without any penalties. All right. Like every rule, there are exceptions to the rule. If you or your spouse plan to work after you turn 65, if you continue to work, then the size of that employer who is offering you guys the employer-sponsored health insurance is the determining factor of whether or not you need to sign up for Medicare at 65. So if you are working past 65 with a large employer, and large employer is defined as 20 or more part-time or full-time employees. So if you or your spouse are working past 65 and you are working with a large employer, and that large employer has you insured under their group health benefit, then Medicare is optional. You and or your spouse, as you approach 65, you have the option to either stay on that large employer group health plan and delay Medicare A and or B, or you can say, hey, it actually makes more sense. I'm moving Medicare when I turn 65. You have a decision because it's optional. Medicare is optional when you have large employer sponsored health coverage at play. All right. Some of the reasons you would stay on the large employer plan versus moving into Medicare. You have an HSA that you want to max out. All right. That's 5 to 10 grand with your $1,000 catch up factored in. 5 grand roughly for a individual, 10 grand for a family that you can take advantage of. So if your large employer group health plan is a high deductible HSA qualified plan, and you want to stay on that plan and continue maxing out your HSA, then generally the recommendation is delay A and B at 65. All right. If there is a younger spouse on the plan or children on the plan, it may make more sense to stay on that large employer plan, regardless of the HSA status. Because if you move into Medicare, you may kick off the spouse or the children. They may have to go COBRA or ACA Obamacare, and that might not be the best case scenario. So again, when we are sitting down with our clients, Yeski Bewey's clients, when we sit down with you, we are asking a lot of detailed questions on our intake form. What's your current work situation? What's the group coverage under that work employer plan? What's the premium? Do you have an HSA? Are you collecting Social Security? What's your modified AGI? We want all of this very detailed information from our clients, because it allows us to sit down and be very efficient on a 30 or 1 hour consultation with you and say, hey, Medicare doesn't make sense right now. We can actually delay and punt the Medicare conversation for another few years. Here's why. You don't have to do anything right now, and don't be scared of all of the, marketing that's hitting you saying, act now, act now. You have to sign up for Medicare, because it might not be the case with your circumstance. If you are on a large group plan, okay, and you say, hey, Margo, hey, Team Steinlage, I'm going to delay Medicare to stay on this group plan and max out my HSA. Then the red flag to watch out for at a later date is that when you move off that group health plan and we start enrolling you in Medicare and we submit the Medicare paperwork, Medicare Part A will have a 6-month retroactive start date. So if you come to me this fall and you say, hey, Margo, I'm 71. I plan to retire on January 1st of 2025. I need to move into Medicare. I'm going to say, okay, great. October 1st, we're going to submit your Medicare paperwork so that we can transition you into Medicare on January 1st. As soon as we submit your paperwork, the month prior, so if we submit in October, the month prior, September, is when that 6-month trigger is kicking off. All right, so that gives you an April 1st Part A start date of 2024, even though you don't want to move to Medicare until January 1st. March is the last month you could contribute into your HSA. So you can contribute 1/4 of the allowed 2024 amount. That gets really complicated. I'm very much in the weeds right now, but I want to put that HSA and Part A retroactive look back on your radar, because we do have to do some homework and time that HSA contribution with your desired retirement date. If you over contribute, you come to me in October and say, I want to retire and move into Medicare January 1. I'm 70. I need Medicare now. No problem. We would have you go back to that HSA bank or administrator and remove, 3/4 of the 2024 allowed amount if you maxed it out every month. Sometimes you think you're maxing it out and you're not. So I guess I would ask, how much have you contributed before we actually go back and start removing? Okay, so that's the scenario for a large employer. Medicare is optional. Does it make sense to stay on the group versus move Medicare? Now, if your employer has fewer than 20 employees, then under Medicare secondary payer rules, Medicare is required in most circumstances. You have to sign up for Part A and Part B as you approach your 65th birthday. Medicare is the primary. And then if you keep that small group health plan, that would be the secondary payer. Reasons why you would keep the secondary group payer as opposed to moving to a supplement or an advantage plan. when you turn 65 is if you have a younger spouse or children on the plan and you don't want them going off into ACA land. All right. If you want them to stay on a very competitive group health plan and it makes sense based on their doctors, their unique needs, then it may make sense to continue paying that secondary small group health premium through your small employer. But you have to sign up for Medicare because it needs to be your primary. The kids, the younger spouse can stay on the secondary small employer plan as their primary. Reasons it would make sense to move off the small group health plan because it's your secondary and into a Medicare supplement or an Advantage product is if we can manipulate your income and their doctors are in one of these ACA networks, it may make sense to move them into a free or very low premium ACA plan if we can work with your advisor and say, hey, we actually have a really unique situation. We can manipulate your income for this year, your anticipated modified AGI, and keep it low so that you get subsidized insurance through ACA. We can try to do that, or it may make more sense to go COBRA. It may make more sense to stay on the small group health plan. Again, we're looking at your entire situation. And what's cool about our agency is we could care less if you go Medicare or stay on the group. We just want you to make the right strategy, the right move from day one, so that we set up a very trusting relationship with you for the next 20 years, because you're going to need this guidance year after year. Again, Medicare is not a set it and forget it relationship. All right, any questions on this? Is like the first 20 minutes of any introduction with our agency is let's get a good high level view of what plans are at play. One note I will say is COBRA is not active coverage. So if you are approaching your 65th birthday and you retire and your employer says, hey, I'm going to cover 6 months of COBRA as a exit bonus. Don't worry about health insurance for 6 months. You were a great employee. Don't take that bait, because you still need to sign up for Medicare. Even though the employer is going to cover COBRA, Medicare is still required because COBRA is not active group coverage. So Medicare needs to be the primary payer in those circumstances. So anytime there's COBRA, and you're Medicare eligible, you need to get Medicare. You need to enroll as soon as possible. We see a lot of hiccups in that space because HR is giving you bad or poor advice. Okay. Real quickly, HSAs, if you were lucky enough to have HSA and you were smart enough to fund it, then you probably have a few $1,000s or many $1,000s in your HSA fund. Once you move into Medicare, you can use the HSA card and spend those HSA dollars on any medically qualified expense. The only thing in Medicare that is not medically qualified is your Medigap Medicare supplement premium. IRS does not deem that a medically qualified expense, but your IRMA, your Part B premiums, your dental, your vision, your hearing aids are outrageously expensive. Your prescriptions are all covered as a medically qualified expense. You can use your HSA card to pay for those expenses. Okay, moving along to the second portion of the webinar. What is Medicare? I'm throwing out Part A and Part B like you already know what it is. Hopefully you do. If you don't, Medicare, when you enroll in Medicare, there's two parts to it. So when you get your red, white, and blue card, you say, hey, Margo, I'm coming off my large employer, or I am turning 65, I'm on ACA or Obamacare. I have to move into Medicare. What are you actually getting? So when we sign you up for Medicare, you get your red, white, and blue card, you're going to see Part A hospital and Part B medical benefit right there on your red, white, and blue card. For most of us, we get a free Part A hospital benefit when we enroll. So you pay nothing to have that Part A benefit on your card. If you or your spouse, you guys can team up together with your work history, have 40 quarters or 10 years worth of work history where you paid federal income taxes, paid your taxes, you get this zero premium Part A benefit. There's no premium. Again, you can piggyback if one spouse worked, the other was a stay-at-home parent, then that stay-at-home parent can ride on the work history of the working parent. For everyone else, the Part B premium, there's a standard premium that's set by Medicare every year, and this is adjusted by Medicare every year. The current 2024 premium is $174 per month per person on Medicare. This premium for Part B is based on your income. So if you're very low income and you qualify for Medicaid, then Medicaid will offset those Part B premiums. If you are high income, earning above $103,000 in modified AGI or $206,000 in modified AGI if you're a joint filing couple, then Medicare will cost more for you. You'll see a surcharge on this $174.70. That surcharge is called IRMA. We will talk about IRMA here towards the end of the webinar in great detail. But just put that on your radar. If you are a high earning individual or a couple, then Medicare will be more expensive. And that comes into play when we're doing this initial assessment of, is Medicare the smartest move at 65? How does it compare to your large employer plan if we have that at play? Or, hey, we have to move Medicare, but be aware Medicare is going to cost quite a bit more for you because you are high IRMA or high income. You get a surcharge. There's nothing worse than thinking Medicare is going to cost $300 for you, and then you get a $500 IRMA surcharge per month per couple or per individual. It's $1,000 for husband and wife. So we always want to, have transparency here. So you sign up for Medicare, you get your Medicare card, you're paying your premium for Part B plus any IRMA. What does Medicare, original Medicare Part A and Part B actually give you? So when you walk in the hospital, let's say, I always say you get hit by the bus. It's a little blunt, but you get hit by the bus, you walk in the hospital, your ambulance to the hospital, and you're there for 5 days, and you have a $5,000 or $10,000 bill. And then you have 7 months of PT and doctor visits that follow. You show them your original Medicare card. You will be responsible for the first roughly $1,600 for the hospital stay. For anything else, MRIs, doctor office visits, PT, that is all going to fall under the Part B umbrella, medical umbrella. You will be responsible for the first $240 for the year, and then Medicare will cover roughly 80% of your cost after you meet those 2 deductibles. The tricky part here is the hospital deductible will reset every 60-day occurrence. So if you go in January and then in June you go in the hospital again for a different need, you're going to reset a $1,600 deductible. You'll also see here that original Medicare does not cover prescriptions. It doesn't cover dental, vision, hearing. So these are the large gaps that original Medicare just does not fill. The deductibles for hospital, the deductible, much smaller, $240 per year for the medical, and then the 20% gap that is remaining after Medicare pays its 80%. There's no cap or ceiling on your 80% exposure. So this is where all of these ancillary products that you hear about over and over on TV and the news and in the mail, you're getting hit left and right if you're approaching 65. With all of these plan solicitations, all of these ancillary products come in to fill the gaps of original Medicare. Really, there's 2 different routes that you can take. If you are a federal retiree with access to federal employee health benefits, let Lauren know. I have a contact who only advises in the federal employee health benefit space, but we at Steinlage do not work in that space. This is more geared toward anyone who's non-federal, non-military. Okay, if that does affect you, reach out to Lauren. I'll share my contact. Tammy is who helps in that space. Okay, so for all of us non-federal retirees or non-military, we really have two pathways to choose when we are approaching Medicare and the decision has been made to move into Medicare. You have your red, white, and blue card. What's the next choice? All right, you can either go on the left side of the screen where you keep original Medicare and you pick up what's called a Medigap, also known as Medicare Supplement Plan, and then you add a standalone prescription drug plan called Part D. So this pathway, you have original Medicare plus a secondary supplement, also known as Medigap, plus your Part D standalone drug plan, plus maybe a dental and vision rider as well. The alternative pathway is for you to sign up for what's called a Medicare Advantage Part C plan. That's the right side of the screen. No matter which route you go, you have to pay that Part B premium plus any IRMA if we can't appeal the IRMA surcharges, the income surcharges. So that Part B premium is pretty standard no matter what decision you're choosing. Some of you may have unique access to a retiree plan. That could be a third option at play. Again, we are reviewing all options to help you make the best decision for right now and also the future. And I'll go over this a few times in this presentation, but your initial decision here of do I go option one, do I go option two, what about a retiree plan, will have long-term consequences. So it's very wise to get all of the information on all of the different pathways so that you're making the wisest decision. All right, so let's jump into kind of the nitty-gritty on plan direction. If you say, hey, Margo, hey, Team Steinlage, hey, Yeski, I really want amazing coverage with no restriction, no managed care. I want to go anywhere in the US, then this original Medicare plus supplement pathway is going to likely be the best path for you. You will keep Medicare. That red, white, and blue card is your primary payer if you select this pathway. Medicare with a supplement, also known as Medigap, and a standalone drug plan. This allows you to go nationwide to any doctor that takes Medicare, accepts Medicare. They opt into the Medicare program, which is about 97% of doctors and providers nationwide. There is no, hey, do you take Blue Cross Blue Shield California? Do you take Anthem, Blue Cross Blue Shield, Care First, Blue Cross Blue Shield, Aetna, Mutual, United Healthcare, AARP? You don't even have to ask that question because as soon as Medicare is accepted by your provider bills Medicare, Medicare turns around and sends the residual claim to your supplement carrier, regardless of who that supplement carrier is, and they are mandated to pay. Okay, so it's a very streamlined approach to billing. There's no push-pull with a third-party company. It's very clean. And these supplement carriers pay the claims and each carrier is a little bit different, but between 2 days and 10 days after they receive the bill from Medicare. And then you'll get like a Medicare summary of notice bill that says this is not a bill, but it shows you who paid and how they paid. Again, very clean, no restriction, no red tape. These plans also allow for foreign care coverage. If you go out of the country, Medicare won't touch you, but your supplement plans will cover, most of the supplements will cover 80% up to a $50,000 lifetime maximum. A lot of our clients will ask about travel health insurance, and for a few $100s, $200 or $300, you can get a very robust plan that really covers you for these foreign care needs outside of the emergency room coverage that you have with your supplement. Then you'll get a drug plan, a Part D drug plan. Those are standalone. You can mix and match your supplement carrier with your drug plan. We do that frequently, so that we're shopping for the best product for you based on your specific drugs each year that you're prescribed. And then we would add a dental and vision plan. Within the supplement market, this is where you have your plan letters. Plan F, if you're older on this webinar and you've been on Medicare for the last decade, you may have a Plan F supplement you're grandfathered in. For anyone new to Medicare, if you turned 65 this year or last year or 2 years ago, you could not sign up for a Plan F because it's a closed block of business. The Plan G, as in Girls Supplement, will work very similar in fashion to your Plan F. When you go see a provider, when you go in the hospital, when you need your MRI, Supplement F and Medicare pays 100% of medical and hospital bills. You have no residual payment after you show those 2 cards, Original Medicare and Supplement F. If you have a Supplement G, you show your Medicare card, and then you show your Supplement G card, you have a $240 annual medical deductible, this deductible right here. Outside of that, Medicare and your Supplement G pays 100% for all Medicare approved services. All right, there's Supplement N. You have a $240 deductible plus $20 copays and $50 copays at the ER, plus this Part B excess exposure. If you go to a non-Medicare provider, or excuse me, a Medicare provider that does not accept assignment, that means they can balance bill you up to 15% above what Medicare reimburses the providers. So Plan F was the Mac Daddy a decade ago. Plan G is the new Mac Daddy. And Plan N, for those who are like, hey, Margo, I don't want to pay, $120, but $90 looks pretty good. Then the Plan N will be kind of a balance of benefits and premium. What's really unique state to state. So if you're in Virginia, anytime you move your supplement or we rate shop your supplement, you have to answer health questions to get approved by the new, more competitive supplement. So if you came to Steinlage last year and you said, I'm in Virginia, I'm moving to Medicare, and we set you up with the most competitive plan. And now, 3 or 4 years later, you say, hey, Steinlage, I want to move from AARP United Healthcare or Cigna, whatever carrier we ultimately went with. We're looking at kind of more major market share, large market share carriers. I want to move to this more competitive rate with Supplement X. We can do that, but we have to answer health questions and you have to get approved. In California, they have a very unique guaranteed issue rule where you can move supplement to supplement without health questions. All right. So every state's a little bit unique, but what's typical here is when you're new to Medicare, we are helping you sign up for Part A and Part B. We're transitioning into Medicare, whether it's at 65 years old or a few years later when you come off the employer large group health plan. We are new to Medicare at that point. You have this 6-month window to sign up for a Medicare supplement or your Medigap plan without any health questions or restrictions. You're guaranteed enrolled in that plan when you're new to Medicare. All right, outside of that 6-month window, most states, California included, you have to answer health questions if you didn't initially enroll in the Medicare supplement when it lined up with your Part B start date. So timing is critical here. This is a very easy topic to get backburnered until the last minute or think, hey, I can do this on my own. There is no reason why you have to do this on your own. There's a lot of free agencies, us included, that do this, take great pride in it, and are there to put sticky situations at ease. All right. This is a very anxiety provoking time for many people. You know, your HR has spoon fed you 3 or 4 plan options on your group for many moons, and now you're moving into Medicare and there's 300 options. Let somebody hold your hand through this. Hopefully you choose us. If not, hopefully you get some great information from the webinar. So this initial decision of, do I go Medicare plus supplement plus one of the drug plans based on your unique drugs at the moment is one pathway. It's very comprehensive if you go this pathway, very limited out-of-pocket exposure. Your only out-of-pocket exposure here really is the Part B medical deductible, the $240 if you go supplement G. All right. Your drug plan, again, our recommendation will vary. It's all based on a few factors. What's your current drug list? What's the premium, the most competitive formulary for you, and which carrier actually has good customer service. There's nothing worse than, you know, saving $10 on your drug plan premium, but having an awful drug plan that when you call for mail order or to get a pre-authorization on a prescription that you needed yesterday, there's 5 days of fumbling through it because the drug plan outsources their conversation overseas. This is where our team can really come in and assist if you need that extra support after enrollment. Okay, so we're looking at many factors outside of just price when we make our drug recommendation. And these drug plans vary drastically. They may tweak the formulary to take your tier 2 to a tier 3 or tier 3 to a tier 4. They may change the tiering copay from a $45 copay in 2024 to a 20% coinsurance, which makes you pay $20 or $200 out of pocket every month. So we want to catch those little nuances with these very simple drug reviews, which is why we hit our clients in August and September to ask for those updated drug lists. A lot of brokerages will just set these plans and disappear, leaving you kind of to fend for yourself. We don't want that. Okay, option 1. Option 2 is you sign up for one of these 0 premium Medicare Advantage plans, also known as Part C. Think of Part C as combining Medicare Part A, Part B, Part D, dental, vision, hearing in one nice little HMO PPO package. You are enrolling in UHC's HMO, Cigna's PPO, Humana's EPO. You're enrolling in some type of managed care product at 0 premium per month. You still pay Medicare that Part B standard rate, the $174 per month. But when you enroll in a 0 premium, Medicare no longer is your primary payer. You have to abide and play by the rules of your PPO or HMO product. Are your doctors in network? Do you need a referral to see your specialist? Can you go out of network with ease? What are your prescription costs under this plan? Are your prescriptions covered? You may or may not get free $2,000 worth of dental. Is your dentist in network? Free gym membership. They're very attractive because they're 0 premium. So you get to save a few $100s a month by not having to pay the supplement and drug plan premium. On the flip side, you have a max out of pocket or a deductible that you must meet before your HMO or PPO Part C Advantage plan will pay majority of the cost for your services rendered each year. So if you walk into that hospital, you get hit by the bus and you show your United Healthcare or your Aetna or your Care First PPO, does that provider take it? Will they agree to see you? Okay, they will. Okay, you have a $90 copay for your ER visit. You have a $300 hospital copay for the first 6 days that you're responsible for. You got an MRI, you have a 20% coinsurance, so you'll see a bill for that MRI. So you pay for services as they are needed under these plans, up to your plan's max out of pocket. And these vary depending on your zip code. On the East Coast, you're looking at 5 to 10 grand a year in max out of pocket. And then when you hit that in copays and coinsurance, the plan will pay 100% once you've satisfied your max out of pocket. Drug copays do not go towards that medical max out of pocket. On the West Coast, you're looking at a little bit more competitive Advantage product in California than we see in the DMV, in Virginia, Maryland, and DC. In California, you're flirting more with like the $1,500 to $3,000 max out of pocket. There is no right answer here. 50% of the population will go Advantage, 50% will go supplement. All right, do you want to pay more upfront in monthly premiums to have total flexibility and no real headache or network responsibility? You just go see the doctor and it's all covered. Or do you want to pay very little upfront and I want to, pay as I use the care? Then, hey, you may have a little bit more exposure if you get hit by the bus and it's a really bad year or two. As my dad always said, put the potatoes in the basement, Margo. I think he said that every month. Goodness. So with these Advantage plans, use your HSA savings to pay for your copays or your coinsurance, if this is the level of care that is attractive to you. No matter which route you're choosing, this 174 plus IRMAA is always being paid. Either you're setting it up for easy pay, or you're setting it up for auto pay out of a credit or a checking account, or it's drafting out of your Social Security account if you're collecting, okay? And then whatever pathway you choose, supplement versus Advantage, left or right, option 1 or 2, you are either paying on the front end or the back end. Now, remember, I said your initial decision here is very critical because of the long-term consequences at play. If you said, hey, Margo, I'm vegan, I run 20 miles, I got the California tan, I look great, and you go Advantage, I'm going to say that's great. Know what the consequence is. You're going to have the network restrictions that could come into play and be a little frustrating. You may have some prior authorizations on your surgeries. That can get frustrating. If you're in a skilled nursing care facility, there's going to be some push-pull happening. All right. But the biggest consequence is if you ever want to drop that Advantage plan and go to the more robust, flexible, non-networked, non-red taped supplement pathway, you have to answer health questions because you're outside of this 6-month new to Medicare window. So you're 65 or you're coming off that group plan and you sign up for the Advantage plan. 4 years later, tragedy happens and you say, Margo, Team Steinlage, I need to go supplemental. We're going to say, hey, how's your health? What's your health risk? We don't make the decision, but all of these supplement carriers will underwrite you, and you have to pass their underwriting sniff test for them to allow you into that product at that point. If you don't pass the sniff test, you're a high health risk, then they're going to deny you access to the supplement, and it forces you into this Medicare Advantage market for the foreseeable future. We can shop HMO to PPO, carrier to carrier in this Advantage Part C market, but you're locked out of the supplement market for the foreseeable future because of your health. And maybe that's, hey, I have PT for the next 6 months, and then once I get a clear bill of health, I can underwrite into a supplement. But if you have chronic health needs, you've had a heart attack, a pacemaker, it's much more difficult to get into the supplement. They'll deny you. If you go the supplement pathway and you set yourself up for just higher premiums, but total access to doctors nationwide that take Medicare, and later income changes, or you don't feel the value of your supplement anymore, we can very easily move you into the Advantage plan anytime during the fall, the open enrollment period. Okay, there's never underwriting in the Advantage plan market or the drug plan market because they receive federal funding, lots of it. They have to abide by the ACA guidelines. They cannot ask health questions or withhold coverage for pre-existings. All right, remember, you have a 6-month window around your new to Medicare start date to get into your supplement without any health questions. Now, if you are on this webinar and you are approaching your 65th birthday, this October 15th through December 7th noise that you're hearing about does not affect you. It doesn't come into play because you're not on Medicare. If you are already on Medicare and you just are here to get a little recap, then I highly recommend doing a review on your drug plan and your supplement. Is there any wiggle room for savings? You know, I had a client who came to us earlier this week who is on a Plan F supplement with Blue Cross, paying about $400 a month for his Plan F. His wife was on the Plan G. We can move them for about $1,700 a year in premium savings to identical coverage with a different carrier. Underwriting is required. They'll pass underwriting, but that's the amount of savings we can catch if you've sat on your supplement for a few years without doing a review. The drug plan, it's all going to be based on your medications and which drug plan has the formulary with the most competitive copays, premium and deductible, and quality customer service. All right. We can shop the supplement anytime throughout the year. It's always subjected to those underwriting questions. So we can shop it anytime throughout the year. Unique for California, we can shop it on your birthday. All right. So call me. We're happy to review that for you. Okay, IRMA. Many of you on here will be a high earning individual. And this is where we love to bring in your advisor so that we can get very accurate information in this IRMA appeal process. But what happens here is when you're in Medicare or you're new to Medicare, let's say you're enrolling in Medicare for 2025, or you've been on Medicare and now it's January 1st of 2025, you're in Medicare. Medicare is going to say, hey, you owe the $174 per month premium, but we're going to tack on the IRMA surcharge because we are using your prior 2-year tax return to set and assess this income surcharge. IRMA is income related monthly adjusted amount. I don't like to say that out loud too often. So IRMA, so Medicare and IRS are always communicating. Medicare gets your prior 2-year tax return to set your current year Medicare premiums. So if you are on Medicare right now, Medicare is looking at your 2022 modified adjusted gross income, whether you filed as a single tax filer or a joint filer. They're using that 2022 tax return information on your modified AGI to set your 2024 premiums. Now, if you're already on Medicare, you're going to get a notice of IRMA update in December saying, hey, Betty, hey, John, we see that your 2023 modified AGI was X, therefore your 2025 IRMA will be X. So you're constantly getting updated information and IRMA premium adjustments every year based on the prior 2-year look back. You're never a set it and forget it on the IRMA. Okay, so if you have a one-off high year because of a capital gain or a required minimum distribution that's affecting you, 2 years later, you're going to see a surcharge in your IRMA. And it may only be a spike for 1 year if it was a one-off, a true one-off event. And then the next year it'll go back down because your prior 2-year return was much less. Okay. If you are working and you have large group coverage, we are looking at this IRMA to say, hey, Betty, you and your husband make $1 million a year. You plan to continue working. You have a HSA. You're not unhealthy. You're not hitting the high deductible. Let's keep you on that HSA large group plan so you can max out the HSA and avoid these IRMA surcharges. And then when you retire, we can appeal IRMA because you have a life event that's happening. Medicare has no idea that you retire, that you reduced your work hours, that your income is dropped substantially because of one of these life qualifying events. Your spouse passes away and they were the high earner. You get a divorce. We can fast track Medicare and say, hey, Medicare, don't use my prior 2-year tax return. It's stale. I've had a life event. I retired last year or this year. Therefore, use my anticipated modified AGI for 2024 or 2025 to set my IRMA. And we can tell Medicare to do that. And if it's tied to your life event, your income reduction is tied to the life event, then they will use that anticipated modified AGI to set your current year premiums. And we have a very good success rate with appealing these, so long as you have a legitimate claim here. So if you're working, you're making 500 grand, and then you retire in 2025, and we move into Medicare January 1st, 2025, Medicare is going to have that old information on hand. They're going to see the higher earning years. We appeal, we bring in Yeski Buie, we say, hey, let's get a clear understanding of this client's modified AGI for 2025. We're going to write that number down and we're going to submit that to Social Security so they can coordinate the new IRMA premium or reduction or removal based on what we tell them. Now, if we are just giving an anticipated number in that scenario, if it comes out that you make much more than what we told them, there's no penalty. Medicare will just say, hey, you told us you were going to fall in between the $386,000 and $750,000 benchmark, and we reduced your IRMA based on that anticipated figure you gave us, but it turns out you actually made much more. They will just charge you the difference that should have been paid for the full year. There's no interest or penalty that they will tack on there. So it behooves you to be a little bit aggressive with this number, because if you say, hey, I'm on the fence here, I'm going to make 800, and if I make 500, so be. They will not credit you for the overpayment of IRMA in that scenario. Okay, they'll only claw back what really was owed if you underestimate. They won't credit you and say, hey, you overestimated, we're going to pay you back. So get aggressive here. We try to get is honest and clear of a modified AGI for the anticipated year by working with your CPAs and your advisors. Okay, the Inflation Reduction Act. How am I on time, Lauren? I know. Okay, 2 minutes here, guys, and then that'll be the end. So what's coming down the pipeline? Pre-Inflation Reduction Act, there was this gaping hole in the Medicare drug world. If you moved into Medicare and you were on very expensive cancer meds or very expensive, autoimmune disease medications, you were responsible for 5% of the cost with no cap. So some clients were paying out 12, 15 grand in drug exposure in years past because they were on very expensive meds. This Inflation Reduction Act is coming in to put a $2,000 cap on all Medicare drug plans, whether you're going Medicare supplement and drug, or you opt for that Medicare Part C Advantage product that has the drug component built in. You have a $2,000 out-of-pocket cap for covered medications in 2025, which is brand new. wheels are in motion. This is regulation that is already like set to begin with planned product flying off the shelf in October. So if you are on very expensive medications, the key here is to finding a formulary that covers those medications. You do not buy drug coverage to cover cheap generics. You buy insurance and drug coverage to protect you against the unknown and unforeseeable or foreseeable high cost medications. So you actually want a drug plan that has a robust formulary. Okay, so when we are looking at these formularies, we're checking to see which plan covers your medications, which plan has good reputation here. When you sign up for the drug plan and you start filling your meds, Medicare is calculating how much you are coming out of pocket in your copays or coinsurance and a drug manufacturer's discount. When those two figures get to $2,000, then the drug plan will pay 100% for the rest of the year. That is brand new regulation that is coming down the pipeline. It's phenomenal for those who are on very expensive drugs. If you're on Humira, Ozempic, and it's on the plan formulary, if you're on any cancer treatment that's being filled through, like oral chemo, filled through the pharmacy, $2,000, and then the plan's covering 100%, which is amazing. The downside for those who are not on very expensive meds is that the premiums on these drug plans are likely increasing. If the premiums stay low, the formulary is going to get thinned out. So you're really only looking at generic coverage. So a lot of changes coming in this drug plan market that will be released come October, hence the need for annual reviews. Now more than ever, we are just, somebody said that we have not seen this level of change in the Medicare market since 2006, when the drug plan component came to be through regulation. Part D came into existence in 2006. So highly recommend the review this year and many, many years to come, but this year specifically. Also, if you are a high earning individual, you'll see here, Part D premiums will also be assessed an income surcharge. So if you're on a $40 drug plan and you're paying Aetna or Blue Cross or UHC or WellCare $40 or $10, you're also going to pay Medicare and IRMA Part D surcharge based on your income. Okay. I'm going to stop there because I see we have some questions. But as you guys can see, there's a lot of nuances at play here, whether you're going original or traditional Medicare with a supplement and a drug plan pathway, or if you're going Medicare Advantage, if there's a retiree plan at play. Does it make sense to move into Medicare at 65? Do you have to, or is it optional based on your employer size? There is no one size fits all approach here. And you can talk to 10 of your friends and get 10 different methods to the madness. You can call Medicare and get 10 different answers to the exact same question. A lot of misinformation that's thrown around in this market, and a lot of people who are unaware of kind of that initial decision and the consequences that can come. So buyer beware, and do your due diligence, educate yourself. These webinars are fantastic, mine and whoever else you watch. But start the process early, have the conversation early so that you are armed with information, and we have a plan of attack as you approach your 65th birthday, and it's a much more pleasant experience than, waiting last minute.
Wonderful. Thank you, Margo. I think we have time for a question or two, so I'll just ask one that I see here. And if anyone else has any, please feel free to throw them in the chat or the Q&A, or we can follow up afterwards. You can email me. But just someone asking if you could talk a little bit about comparing traditional Medicare and Medicare Advantage for skilled nursing care coverage.
Yeah, and this is where we see the most headache is when you have a skilled care need with a Medicare Advantage plan. You know, all of the skilled care facility providers will say, go original Medicare, get your supplement, because here you have this third party managing your skilled care, and their incentive is to get you out of that skilled facility as quick as possible and limit their out-of-pocket exposure. So you have the third party managing the care, putting on their rules, their restrictions, plus your copays while you're in the skilled care. With original Medicare, original Medicare is dictating the show. All the bills are going through original Medicare and going down to your supplement, and they're paying 100%. So one's very flexible with its coverage on skilled care and covers it at 100%. The other is going to have this push-pull red tape in most circumstances. And network. Does your skilled care facility accept your Medicare Advantage plan? So network restrictions, pre-authorization, timeliness, and then also copays on the flip side. So it can be a headache no matter which route you go, let's put it that way, but one's a little bit more cleaner with the billing process and the network process.
Wonderful. Well, thank you so much, Margo. I had two other questions here just about if you're available for consultations for specific circumstances. Absolutely. And just for your email address, which I will post in the chat for everyone. We'll also make sure that it's on our website when we post this recording there in the slides. But I just put it in the chat as well, so everyone can have that. And Margo, again, thank you so much. This was incredible, really, really good information. And like you said, I know this can be such an anxiety-inducing time going from a couple selections while working to hundreds of options in retirement. And so just appreciate all of your expertise here and your work with everyone on this call who you've worked with or will be working with soon. So thank you so much for your time today.
Awesome. And I'll send you some information here, Lauren, after the fact, the slides and then Tammy's info as well.
Yes, and we'll put that on the website as well. So anyone who may be in the federal benefits area will have Tammy's information as well.
Okay. Thanks, Lauren. Have a good one, everybody. We'll touch base soon.
Thanks.